Okay, so welcome everybody to the first bite of 2024. My name's Veronica. I work here at the Aboriginal Health Council with my colleague Ashley Spratt. And I would like to introduce you to Charlie and Reese, who are peer educators at WAC. Thanks very much for joining us.
Great, thank you, Veronica. Thank you to the Aboriginal Health Council for having us today. I'd first like to start by acknowledging the traditional custodians of the land, the Whadjuk people of the Noongar Nation, Nalakadej, Noongar Kayi Kadak, Nitrawutja. And we would also like to acknowledge all the people that we've lost to HIV and AIDS related illnesses over the last 4 decades. They were the ones that were really advocating and trailblazing and changed the way that most people view HIV today. They pushed for all the medical advancements, and without that, people like Charlie and I wouldn't get to live the lives that we do today. So, yeah, we're going to be talking about a few things today, Charlie.
Firstly, I'll start with an introduction, a little bit about WAC. So, it began as the WA AIDS Council, and it was established in 1985 in response to the global crisis. When it started, it focused on helping people die with dignity, but obviously thanks to medication, people are now living with HIV and they can live long and healthy lives. So now it's been rebranded as WAC, and they have been operating in a total of just over 35 years. And we provide much needed support to people living with HIV. And now we have expanded and we do many other services as well.
So Charlie and I are both peer educators at WAC. I've been working there for about 18 months now. I was first diagnosed with HIV back in 2016 when I was 20. Main sort of day-to-day duties is quite a lot, but we mostly provide psychosocial support to people living with HIV. We do a lot of advocacy work. We have groups. We go into lived experience talks. We have a consumer reference group that we facilitate. Our day-to-day looks very, very different every time.
Absolutely. My name's Charlie. I am originally from the UK. I came to Australia 5 years ago. I was diagnosed with HIV in 2015, the age of 21. I've been with the WAC for, only for 3 months now, but like I was saying, it feels like 3 years. Not much more to add to what Reese said, really. It's a really great team at WAC, and I feel really privileged to be a part of it.
You're both the same age.
Yeah, yes. I'm a little bit older, yeah.
I'm not closer to that age. Okay, so I'll just read my notes here. I'm a little bit nervous. I don't want to get anything wrong. So HIV information and treatment. So just a quick overview. HIV does not equal AIDS. HIV is a virus that attacks the immune system, and if left untreated, then it can progress to AIDS. And basically, how much of the virus is in your blood, viral load, for example, this informs us on how sick someone may get, or the likelihood of transmission of the virus. So U equals U, undetectable equals untransmissible. This is a person who is living on effective HIV treatment, and someone who is living on effective treatment cannot transmit HIV sexually. The person living with HIV and who is on effective treatment can live a long and healthy life. HIV is only transmitted through blood and sexual fluids, and this is including breast milk as well. And also HIV, some of you may not know that it cannot live very long outside of the body as well. So there is actually also medications to prevent the transmissions of HIV, and this is ART, and this is for somebody who is positive and they will take medications to suppress it in the system, like I just spoke about. And we also have PEP and PrEP. And so this is medication for people who are negative. And this will act as a block, so it will block any transmission of HIV. So somebody, for example, who is sexually active, they can take PrEP daily, and this will just prevent HIV being transmitted. Or you can also take it sort of, I say as and when, but you do need to speak to your doctor about it, because you can take, they say to take 2 tablets 2 hours before, I believe, and then take 1 pill every day for 2 days afterwards. But yeah, speak to your doctor about that just to get that confirmed. And as of June 2023, HIV medication is now free in WA, which is a huge step forward. And also with the medication now, there is very little to no side effects, and the side effects are very tolerable with their recipient. So we have come on huge steps since the first medications came out. We are now looking at injectable medications, so people are able to have an injectable treatment every 2 months, which is a huge step, because especially for a lot of people that we work with, taking the medication every day acts as a reminder, reminder of the stigma, and reminder of living with the virus. So it can be very effective in people's mental health. So being on injectables is actually massive for some people, and yeah, it's really very good.
I think we covered it.
And I think with the injectables, how wonderful for people that are transient, people that are homeless, or people that are struggling to,
Yes.
I guess, find somewhere to sleep, or living in overcrowded housing.
Yeah. Well, that's it, absolutely. Especially, I mean, with some of the clients that I work with, having to hide the medication, if you're living in even if you're sharing a very close space with somebody, having to hide the medication and then be able to have the moment to then take it every single day is exhausting. And we spoke about before, especially if you are homeless, or, you have other priorities such as food, shelter, taking your medication can unfortunately be forgotten about. So the injectables is a great way to make sure you are still remaining undetectable, and you're able to then navigate the rest of your life. So it's great progress.
It is. And for some of our health workforce who actually care for some clients who are HIV positive, and because of their, the fact that they're transient or maybe homeless, they often will have, caseworkers to go and give them their medication on a daily basis. So again, the workforce capacity that is required for that, and to have an injectable for that reason as well also helps.
Because I think at the moment with the injectables, they are still assessing how compliant somebody is with their medication. But I think they are starting to understand that it is actually more important for people who do struggle to adhere to the tablets.
Yes.
But I think because it is so new, they're still sort of learning and seeing how it works in the community. But I mean, from the feedback that I've got, it's very positive, and especially from all the nurses and doctors that we work alongside with, they're all have very good feedback from the injectors. Yeah.
I've been taking it myself now for about 9 months.
Yeah.
I actually just got it done yesterday. But I've been walking around, that's why I'm walking a little bit like a penguin.
It's sore.
It's a little bit like when you've done like a really intense leg workout and you got that sort of tightness a little bit.
I don't know actually. I used to. Okay.
So it's a little bit like that. So you can sort of feel like a little bit of tenderness, but that's only for a couple of days.
Well, that's good to know. That's good feedback.
Yes.
If for health professionals who might be actually, doing the injections to
Yeah.
So like it's just a tiny little prick on each side. It doesn't really hurt any more going in than what I guess a regular vaccination or immunization would.
Okay.
But yeah, you just get those.
It's just afterwards.
Yeah, but I've noticed the more I've had, the less amount of time it sort of the pain seems to stay for. So I think you get a bit of a tolerance.
Yes, that's what I've heard that as well. That over time, like your tolerance builds up, and eventually, hopefully, you won't feel it. You won't feel it.
That's great.
It's really good.
Excellent.
So just quickly, we have spoken with other professionals, and they are looking at PrEP as now being injectable. I think this is something that's coming in the future, but I think that will also be amazing for preventative treatment to have that as an injectable, because I think also people taking PrEP, not everybody wants to go and take the medication or remembering to take it, because obviously it is important, but not as important as obviously antiretroviral.
Yeah.
So I think having the injectable for PrEP will also be another huge leap forward in prevention treatment. Yeah, it's already positive. Yeah.
So some of the other services we have at WAC outside of what Charlie and I do. So we have case managers who do very intensive case management. They work holistically. They have a very good person-centered approach. They look at all the aspects of a person's life and sort of assess the best way that we can support them from there.
Yeah.
And it can be range from various things. So it can be assisting with medical appointments, food relief,
Housing,
transport,
yeah.
It's something less.
Yeah, it is. Yeah, I think. Sorry to interrupt, Chris, but what I really liked about when I came here is that it was very meet people where they're at and focus on the needs, their immediate needs, and what they're asking for support with. We support them with, and it's. I mean, from what I've seen, it's very effective. I think.
Well, people would really respond to that,
Yeah.
because that's what's worrying them at their time, and somebody's actually acknowledging that. Okay, let's see if we can help you with that first.
Yeah.
I think that's so powerful.
Absolutely. Absolutely.
And they sort of acknowledge that, we are all the expert of our own lives. We don't pretend to go in there and pretend that we know better than what they do.
Yes.
Yeah.
We actually listen to them and hear what they want and just sort of work with the person.
Yeah.
They feel like they're actually involved in their care. They feel like you're invested. And it makes you get much better, outcomes.
Yeah.
Working that way.
Yeah.
We also got a counselling service. So they can see people in person or online. So people that live regionally, it's not a barrier for them. We can help them out as well if they need.
Yes, yeah, which I think is really great, because a lot of people online are from the regions. And knowing that maybe someone who's newly diagnosed, who's just trying to deal with the diagnosis and be able to speak to someone who's been through it,
exactly. It's very easy to self-refer, and we're quick to get back to you as well. And even if you are just looking for a one-off conversation, just to say, hey, I've just been diagnosed, what does the future look like for me? Then we are there on the other end of the phone to kind of help you and share our knowledge. And I spoke to somebody recently, and they said, it's just really great to speak to somebody who's come out the other side of this and is doing something positive and is happy and living their life, and I think just that in itself is such a huge thing for somebody who's just been diagnosed, to be able to see that future. So
yeah. And also, see strong, healthy person in front of them as well.
Yeah. We've also got M-Clinic as well.
Yeah.
So M-Clinic is a sexual health testing clinic, primarily for men who have sex with men, or people who identify as transgender or non-binary. So the reason we generally take our clients there is to get their bloods taken for when they do have an upcoming hospital appointment. We have seen that people have faced discrimination from phlebotomists when they see HIV on the form, and we just want to try and remove sort of any chance of that happening. The team at M-Clinic are
amazing.
They're amazing.
Yeah.
I work there as well, so yeah, I'm a good client. They're a really awesome team. They're also supportive. They're very caring, and they're so knowledgeable on everything that's sexual health related.
Yeah.
So it's a very safe space for our clients. And we've got the needle syringe exchange program, which again, we've got a couple of clients. We'll sort of take the buckets out to them, do a little swap over, make sure they've got all the equipment they need. Because, like we said, we meet the person where they're at. We're not going to tell them that their drug use is a problem, and that's not our place. The best we can do is just make sure that they at least are as safe as they possibly can be.
Yes. Yeah, and what I really found great about NSEG was that they have a van that goes out to different communities, suburbs and stuff. And I actually did a shift on there, and it was so great to see that how many people came and how many people would come regularly. And so, there was such good interaction there, and there was all the information there, like how to use safely, where to find back, all the information you could need. And I just thought it was a really great service that they were providing.
Friendly face.
Yeah,
Smiling face.
Exactly.
No stigma, no discrimination. You are welcome.
Yeah. And we, sometimes we're having like really deep, meaningful conversations. The other times it was like a light-hearted chat about them, but it was just that. Yeah, that, like you said, the friendliness and the norm. Yeah, absolutely. I think it's great to have that outreach service. Yeah. But just touching on the experiences that our clients are currently facing. So we kind of dipped in, I think, a little bit. So we are working with people who are homeless, experiencing domestic violence, who are experiencing social isolation, who have experienced in the past and currently experiencing different kind of trauma and stigma because of their HIV. So we like to advocate for people as well by going to appointments and kind of giving that kind of support for other people, because we are finding that a lot of our clients are still living with a lot of internalized stigma. So a lot of the stigma does come from when the epidemic started, but it's also then followed through to now. And I think that's kind of the main issue that we're facing at the moment. It's not that people are dying of HIV or AIDS-related illnesses now, but it's actually the stigma that they still face. And that comes from medical professionals as well, which is obviously supposed to be a safe place for people. But unfortunately, we are still seeing, and people are still telling us stories of people double gloving and just basically showing a lack of empathy, I think, towards some of our clients, which is what me and Reese and the rest of the team try and really promote, is that kind of support and advocacy for our clients. So,
I've I had a couple of people share some of their lived experience with me. They're very kind.
Yeah.
I am going to look down just while I'm reading it, just because I really appreciate them sharing their story with me, and I feel like it would be an injustice to them if I was to miss anything.
Yeah.
I have sort of de-identified both of them, so I'm not going to mention their names. But first lovely chap. So he grew up on a farm in the southwest of WA, and sort of grew up knowing that he was gay, but had nobody to reach out to or talk to about that. I guess small country towns, very taboo. By the time he got to his 40s, he was only out to his closest family and his friends. And he was diagnosed a week before Christmas in 2012 with HIV, which came as a bit of a shock to him. He has faced some very unique challenges living rurally, living with HIV and living as a gay man. He did recall one incident where he went to a medical facility for treatment of a different STI. And when the nurse found out he was gay, he told him, "We don't talk about being gay in this town. We don't like that, so don't tell anyone." And he has had very awkward encounters with phlebotomists and doctors, sort of what I spoke about when they see the form with HIV written on it, then getting a bit almost like they don't know what to do. He said one of the phlebotomists had to actually make a phone call and figure out, how do I actually do this test? He went to see a doctor. In the form of his medical history, when the doctor saw HIV written on it, he saw that the doctor physically looked uncomfortable and just tried to usher him out of the room. Because of him living rurally as well, access to medication is a little bit different. So Royal Perth will generally send the scripts out to him by SMS. And again, with a small town, one of his mum's friends works in the pharmacy where he has to go to. He reported that he's had a very easy time every time he's gone there, despite being very paranoid every time he does have to go there. And what he has said is there is just a lack of education and awareness in rural areas, and it's left him feeling really isolated, not only as a gay man, but as a HIV positive man. And he said it's mentally challenging, anxiety provoking, and he feels on his guard all the time.
And does he still feel like that, like to this day, or does he have better experiences now than he used to, or because I mean HIV is on a lot of forms that we it's sort of becoming more routine testing.
Yeah, I have spoken to him quite a few times over the last year.
Yeah.
And yeah, it does feel it's a small country town feel.
Yeah.
People still not being the most progressive.
Progressive, yeah.
So yeah, he just unfortunately did still struggle with that, but we try to support him as best as we can.
Yeah.
He knows that we are here.
Yeah, it's great that he was happy to share that.
Yes. And I've got one more personal story who I'd like to share, who is an Aboriginal man that we both know, who works closely with us. So he was diagnosed in 2002. He was sexually assaulted on his 22nd birthday, and shortly after was diagnosed with HIV. Unfortunately as well, he was in a relationship at the time, and his partner tragically passed away just a few short months later. He reported that he has dealt with stigma and discrimination more times than he can remember. He recorded an incident in 2009 where his employer found out about his HIV status and sacked him. He has previously had photos shared online of him where people have posted about his HIV status, warning others to stay away from him and branding him as dirty, which are horrific things to do to a person, just a side note, regardless of their HIV status. He did report he has also started injectable treatment in the last couple of years, which he said has allowed him to feel like he has a life again and he's now worthy of being alive and enjoying life. Taking tablets every day reminded him of his illness, stigma, and reminded him of his past. He doesn't have to worry about packing medication when traveling, which is a small thing that most people would take for granted.
Yeah.
And he said it's only in the last 3 months that he has felt more safe and comfortable to be open about his HIV status. And he is now a very strong advocate for Aboriginal people, LGBT people, and the HIV community, HIV positive community. And I know both of these men. I've gotten to know them quite a lot over the last 12 months, and after going through all that, and they are still here. They still managed to crack a smile. I think it's just a testament to their strength and resilience. They both sat on our consumer reference group last year. They are amazing advocates for their communities. And honestly, I think they're both amazing. And I'm very grateful that they were able to share their stories with us.
Yeah, that's really great. I can hear that.
Yeah.
So that's roughly about what we had prepared. For a question.
But first of all, has anybody got any questions for Reece and Charlie? I have a couple lined up, but I wanted to throw it out there to you guys. Oh, well, I'll ask the first one. So what are some of the common myths or misconceptions that you still hear about HIV?
So the big one would definitely be that it's only something that affects gay men.
Yeah,
Is a very
absolutely.
strong misconception.
Yeah.
I did a little bit of work in a high school about a year and a half ago just before I started at WAC.
Yeah.
And even some of the teachers thought that it was just a gay disease, or just at least something that if you're a woman, you couldn't get it. Just very wrong information, and it's concerning that they are teachers.
Yeah.
Yeah, okay.
Again, I think people are still confused about how HIV is transmitted.
Yeah.
I know that when I was first diagnosed, I told a few of my close friends, and one of them then did not want to share a drink with me.
Yeah.
It's quite offensive.
I think, yeah, and it's that, again, going back to like the lack of education, and especially in schools and things like that, we're not being taught the correct information, so people are still going off of, you know, the sort of propaganda that was pushed in the early days. And I know for myself, that was the one thing, was stigma and the lack of education, having similar experiences, you know, people not wanting to share drinks and things like that. And yeah, I think coming is that if we had more education starting maybe in schools, and then it would kind of reduce that stigma even further, I think. And, you know, stop any of these misconceptions that we still have nowadays.
Do you think it's because like HIV is so treatable now and people are managing, you know, to live a long and healthy life like anyone else, and now we don't hear so much about it? Do you think possibly?
I think so, because I think the media, they sort of like to sensationalize things.
Yeah.
Yes.
Yeah. Yeah.
Because people aren't really dying anymore. They don't want to report.
They're not real good on the good news stories, are they?
No. And when we do see HIV on the news, so there was a story, I think it was last year, it was about a man who was in a prison in Adelaide. So he, I do not approve of spitting on people, but he spat on a prison officer. Yeah. And the headline was HIV positive prisoner spits on prison guard, which sort of is HIV relevant to that.
No. And that drums up the misconceptions of how it's transmitted and
Yes.
Yeah.
Okay. Oh, Cherry's got a hand up. Yes, Cherry.
Hi, great presentation, guys. Thank you. I was just actually talking to somebody that came into NSEP just in the last few weeks, and even though like my age groupers kind of still remember the horrible ad with the Grim Reaper, it's interesting that even the younger people have heard about the Grim Reaper and about that everyone with HIV is going to die, etc., etc. I would have to say that would have been the worst campaign that has ever been rolled out. And I think there's a lot of residual thoughts and preconceptions still based on that, because the talk continues within the community and outside that community as well. So it would be really, really great that, maybe when we're looking at posters and, I mean, even ads on the TV regarding HIV, it would be really good to have the positive stories. Like I find I get much more interaction by saying, thank you for putting your dirty fits into the containers, into the sharps container, not you have to put them in the sharps container. It's the whole turnaround of it's, we appreciate what you're doing. And I mean, not that everybody does, but we want to have that positive spin on stuff. So since the Grim Reaper has done such a bad thing, it would be great if you had any kind of campaign coming up. And I mean, it doesn't have to be everybody's life story. It's just about, I was diagnosed, like I was diagnosed, 30 years ago, and I'm leading an active life, and I've got a dog and a cat, and, it normalizes it, doesn't it?
Yeah, absolutely.
Yeah. So what would you say would be the best way to support someone who is newly diagnosed with HIV?
I think leading with empathy and listening to someone, I think, is key. I remember when I was first diagnosed, and you kind of go into a bit of shock, and I just remember that I sort of came to, and the doctor is just asking me all these questions which kind of were relating to my sex life and this, and it was just so not what I needed in that moment, and I think if I just had somebody who just was there and just kind of let me be, and then sort of, had all the information there, so when I was asking questions, they could just answer. And then also to guide me in the right direction. I mean, eventually I did end up having peer support myself, which was amazing, because it was, that kind of support that I needed. And I think it's just making sure that you have all of the information there, and you have all of the services that you can guide someone to if they are struggling with their diagnosis. Yeah.
That's great. That's really good information, I think. And I guess always, having that follow-up sessions, those are really important, having them so that the person has got that sort of set for them and organised and help them with that.
Yeah, absolutely, absolutely. And making it not just a medical follow-up, making it kind of a how you go and follow up, so it's not just like, okay, come back here because we're going to do your bloods and then you're going to get started on this treatment, maybe like a little checkup to see how you're doing with this. Have you spoken to anyone? Do you need to speak to anyone? And just kind of being a bit of a person rather than a medical professional dealing with, because I think it's different than just other diagnosis because of all the stigma that comes with it. I think it's, it needs that kind of personal, empathetic approach, and rather than just sort of a medical point of view.
Oh, that's great. Look, I know that we've gone over time. I'm actually going to stay a little bit longer because I didn't record, so I would like to just capture a bit with Charlie and Reese. And I also have another question for them around, how does WAC address stigma and discrimination? But please, if you need to go, guys, you just leave. And thanks for joining us. But I'll keep chatting away here. Yeah, more than welcome to stay on if you want to. Okay, so with that, with WAC, what are they doing to address stigma and discrimination? What are some of the things that WAC's actually got planned or already doing? And
So at the moment, we are sort of hearing from our clients that a lot of the stigma and discrimination they are facing comes from not everyday people we meet in society. It's more people working in healthcare, other support services. So we are doing a lot of education to make sure that if they are engaging with other services, it's not happen. And I think as well, when you get you're stigmatized or discriminated against from a doctor, it hurts a lot. It hits a lot differently.
yes.
We're sort of told from a young age that doctors are people that you should trust. They will care for us. And then when they sort of treat you badly, it's sort of this twist the knife a little bit more that you wouldn't expect it from someone who has studied medical.
It's supposed to be like a safe space. You feel like when you go to the doctor, you're really sharing your intimate sometimes, your problems, and you kind of are hoping that they're understanding.
And it stays with you.
It does. And
puts a mistrust there as well. That's the other thing.
And then creates a barrier to people wanting to access healthcare. Because no one would want to go somewhere where they're going to be made to feel like shit about themselves. So it's a lot of that work that we sort of have to undo when we meet with clients. Another thing that we are working on at the moment, which is quite a large project, we're sort of looking at HIV decriminalisation.
Okay.
So it's probably quite a few years this project will take. So there are no laws currently that will prosecute anyone just for having HIV, but the way that the law is written at the moment isn't the most helpful, we're sort of finding. So at the moment, the way the law's written, it doesn't recognise you and cause you as a preventable risk to HIV transmission. So we would be looking for the law to be written a lot clearer.
Okay. Okay. So what does it say at the moment, that you are taking precautions or something to prevent?
Yeah.
Okay.
I can't remember off the top of my head what it says, but it's a little bit vague. So
Okay.
that, I guess
Yes.
People could take it,
Yeah.
read into it and go, it doesn't say that, or someone will say it does say that, but
Yeah.
it's not clear.
Yeah.
Okay.
So, and it's sort of each state as well has got their own different way of wording it as well.
Yeah.
It's not across the board the same.
Yeah.
I know that in WA we have a law that's sort of it creates like a fraudulent crime as well. We're sort of taught as well, if you are HIV positive, you're undetectable, you don't have to tell people about your HIV status because there is no risk to that person.
Yes.
Where the law sort of says that you are potentially misrepresenting yourself, and that person has then not fully consented to engaging in sexual activity with you. So it gets a bit
confusing.
It's challenging, yeah. And I think it then is kind of, it's not really supporting the U equals U, which is fact, you can't pass it on if you're on treatment. And I think that's, then it goes back, I keep talking about stigma, but it does always go back to the stigma, because how are we saying that, it is just a normal, like a kind of a health condition that is safe if you are on treatment, if you've then got a law that then kind of goes against that and saying that it's fraudulent. So I think that's where the decriminalisation is kind of the next step, because it kind of does make it just a health condition rather than this.
At the moment, it sort of feels like Department of Justice is not fully on our side, which then stops people from, if you say misrepresenting yourself by not admitting you have HIV, you're potentially putting yourself actually in danger by disclosing your HIV status, because you don't know how that person's going to react, you don't know who they're going to tell. It creates a whole, just this big ball of all sorts of, opens the door for a lot of problems, really. So we'd be looking for a lot more clarity on what's going on. So we are teaming up with NAPWA. I don't know if you heard of NAPWA before. The National Association of People Living with HIV. Australia. We are sort of teaming up with them. I know that our CEO has sort of got some senators that he's looking to get involved with as well. So that it's sort of a collaborative approach amongst different corners of Australia. It's not just a whack thing. There's a whole.
Oh, that's right. You've got a lot of, and not necessarily all HIV support organisations, but other organisations as well that would be part of the advocacy. And
Absolutely.
Because we want everyone to be able to live safely as they can.
And the law is really important.
Absolutely. It's been a big one. But we do find, I guess, like sometimes the law doesn't always catch up with medicine.
No.
They're a bit behind.
But good on us, WA, for being the first state to be rolling out the injectable treatment. I just think that's really fantastic.
Absolutely.
And also, to put another positive spin, you must also come across people living with HIV that have had really good experiences with their medical, one-on-ones with their doctors, and that have got really good supports as well. So,
well, and I think for me personally, apart from when I was talking about when I was first diagnosed, but really that wasn't a negative experience. I can't really think of any negative experiences that I personally, I've heard other people have, but for me personally, I've always had quite good experiences and people have been quite helpful. Especially I've done a lot of travelling as well since being diagnosed. I've always found, especially in Australia where I've been, everyone's been very helpful with medication and doing my bloods and everything like that. So Yeah, there is definitely some good people out there.
But I think education is a really big thing.
Yes.
Huge part of the issue is people just they're just not educated.
No.
Or they're back in the days that Cherry actually mentioned in the Grim Reaper days.
Yeah. And I think it definitely starts in schools. I think to have more education in schools so that you know, you're learning about this, because I don't remember. I mean, I grew up in the UK and was diagnosed there, but I don't remember. I remember maybe it was lightly covered or we brushed over it lightly. And I mean, who knows what would happen, but maybe if there was some more education, and especially being a gay man and going and meeting other men, I would have been a little bit more cautious. Just because then there was that education there rather than just thinking, well.
And yeah, I remember in school, when I was in high school, we actually did get shown the Grim Reaper ad as part of our education, which...
Really?
Yeah.
And you're 27.
Yeah, this was just over 10 years ago, and that ad was made in 1987.
Okay.
So it was well and truly out of date.
Yeah.
And I went to a very, very religious school, and they just sort of glazed over it like, as long as you're not gay, this don't affect you, but none of you should be gay because, you know, we're all... It was like... and yeah, so I don't really know with the Department of Education what that looks like now in terms of how they roll out sexual health. But I remember when I was getting taught, it did feel like it was taught from a very heteronormative standpoint.
Yeah.
And I think it's a big discussion at the moment about...
Yeah.
There is a lot of work happening in that space.
Yeah.
And I know that, I don't know if anybody's online from our sexual health love and virus program within the health department. They have they put together a healthy relationships program and for young people in school. SHQ do a lot of work. Ash and Katiska with their young leaders program are really trying to do a lot of work in getting to schools.
Yeah.
And often, and also there's some training for teachers, because that's exactly who you want.
Exactly.
Yeah, because they're the ones that you see every day.
Yeah. I mean, even one of my really good friends, she's a teacher and she teaches phys ed, so she does her whole health classes and everything. Because she said, because I'm quite open with her, especially, and we talk a lot. And she said from that she was then able to, when kids would, start throwing comments around about AIDS and everything, she's able to pull them up and give them correct information, so it's so important, because even in those little conversations, she's able to change someone's whole perspective on what HIV actually is. So definitely educated teachers.
Cherry.
Oh, sorry, Cherry. Yes.
Gerard, I was going to say, just last week I was giving education session to adults, young people, but I had someone say to me that you seem like a nice lady, how can you morally do this for work? So I coordinate the needle syringe program, and I'm sure that you've probably had very similar conversations. And I mean, I've been doing this a long time, and I decide which pocket or which hat to pull it out of, but I usually really reverse it around and say, well, gosh, have you never let your kids use condoms, because it's a preventative, and so this is what I do, and they have to really think about that. You're right, it's changing the narrative so that it's part of the conversation.
Yeah.
And I mean, as soon as you say HIV, they go, oh, you mean AIDS?
Yeah.
It's that whole, there's no definition in the public's eye, I really think there just needs to be a lot more positive, a bit like the like the hepatitis C, like my name's Joe and I do this, and I'm hepatitis C positive. It's the person, isn't it? It's not.
Yeah.
You don't shake hands and go, hi, my name's Cherry and I've got HIV. It's about who you are. I mean, doesn't matter if it's HIV or hepatitis or Ross River virus, I'm not downplaying it. I'm just saying that we want it to be the norm conversation.
Absolutely.
Yeah.
I could come and work for you guys.
Yeah.
Thanks, Jerry.
Yeah, thank you.
Yeah. Sunny, you're online too. You got any questions for?
Couldn't find my mute button.
Oh, okay.
Sorry. No, that was really great talk. It was interesting to listen to. I am embarrassed to admit I didn't realize that the stigma was still such a big issue. I don't know. I mean, yeah, I just thought things had moved on since then, but I don't move in circles where I work with people who have to still face that. I mean, I do work with people who face discrimination and that sort of thing, but not because of a HIV status. And yeah, although I have to say we had people in community who had locally acquired HIV, and they, I mean, you know, it was very hush hush because of worrying about people in community finding out and the consequences of that. But yeah, I just couldn't imagine, like, life just seemed so hard already. I just couldn't imagine having to deal with that on top of anything else, to be honest. And it's not a small thing, you know, if that's something that people are going to judge you for. And yeah, I was going to say that fella that you've been talking to, the Aboriginal fella, who's now feeling better about his diagnosis and happy to chat to people. Have you tried to get him on board to get, you know, get a peer educator role?
I think he would be interested, to be honest.
Yeah.
Yeah, good. He sounds like a great candidate.
Yeah, he's awesome.
Yeah, it's been a great talk anyway. Thanks, guys.
Yeah.
Oh, thank you.
Yeah. Yeah. So thanks so much for joining us. It was really, really good. I'm really sorry I stuffed up with the recording, but I know Ash will definitely help edit it. If you wouldn't mind hanging on for 5 minutes, we might just do an intro and capture a little bit of that beginning, and then we can cut and paste it on.
Yeah, absolutely.
Sherry, thank you so much for joining us. You're always so wonderful with your, you know, you've always got plenty of questions. She's just really so engaged.
Thank you so much.
Thanks heaps, Cherry.
Thank you very much. I was just going to say, Veronica, when I was nursing back when the dinosaurs roamed,
I was
worked
one of them.
Yeah, in New Zealand, I did not work in the ward, but there was a patient in there that had, he was in the age stage, the last end. So we're talking before PrEP and everything. And he had a team of people and only like 4 people knew what his diagnosis was. And all the rest of us were told he had active TB, and that's why he was in isolation. But, you know, that was a long time ago, and it's just so lovely. I get to see occasionally some of the shared clients that we have with our HIV case manager, and it's just lovely that, you know, to come in and have a chat and off they go, and it's such a huge difference. So, you know, I've lived through seeing different things, and it's absolutely, let's, you know, get some more really positive stuff out there, I think. So thank you. I've really appreciated your chat, and I'm sure we will meet again.
Yes. Thanks, Cherry.
Thanks, Veronica. Bye.
Bye.